Every day across the European Union, 10 people die waiting for an organ transplant. And many patients have to wait years before a donor organ becomes available. The EU wants to increase the number of organs available for transplant by developing tough new standards on quality and safety. And MEPs from our group have been instrumental in shaping draft legislation on this subject. This week, the Parliament's Environment and Public Health Committee has approved a Commission proposal for a directive on organ quality and safety. Many different transplant systems exist in the EU's member states, and often there's very little coordination between them. The Commission wants to make quality and safety standards uniform across the EU. According to German MEP Peter Liese, himself a former paediatrician and now the EPP Group's coordinator on the committee, that's the right approach. But there are areas in which he thinks the Commission's plan can be improved even further.
It puts a little bit too much bureaucracy. The Commission asks every member state to establish a national authority. In some member states, the national parliament, gave the task to supervise the organ transplantation to a non-state body, for example, the Doctors' Association. And if this works well, why do we need to change it? And that's why we want to make a provision that we need not no authorities, but we need a good working system in all 27 member states. And there the Commission text needs to be changed.
The idea of an EU network of organ supply makes sense in a union where internal borders no longer exist. It also greatly increases the number of organs potentially available to transplant patients across the EU. But given that national governments have had primary responsibility for healthcare, efforts to develop a European perspective on this issue have met with limited success until now. Miroslav Mikolášik, an MEP from Slovakia, is himself a former hospital doctor and the Parliament's rapporteur on this subject. He sees great possibilities opening up for patients in need.
So far we had only certain countries exchanging among them, like in the frame of Eurotransplant or Scandia Transplant countries. And there was much less or even not at all exchange with many other new member states, including my country Slovakia. And we would love to exchange, for instance, with Germany or with Austria or with Spain in order to serve our patients and serve Spaniard patients and vice versa, of course. So this is one way in which I hope there will be much more transplantation, much more exchange and much more organs, because nowadays, as we speak, 60,000 people are waiting for an organ.
So, as the European Union moves towards adopting legislation on this issue, the many thousands of patients in hospitals throughout the EU waiting for a transplant are being given new hope. For more information on our group's activities in the field of public health, please visit our website, eppgroup.eu. Thanks for watching, and see you again soon.